I wanted to do was have a look at what we've actually achieved to date from the last meeting. We had some of the information sent through for the audit figures for admissions. Right. And it was working out around 80% of the admissions were from the top 2%. So we've got a very, very clear cohort of numbers that we need to look at.
The aim of our project was to reduce the non-elective admissions in our 2% at risk population by 10% in the month of September this year compared to last year. And what we decided to work on was, one, having a local single point of access, co-location, having MDT meetings, also addressing polypharmacy. So we had a pharmacist review some of our at-risk patients because there is a link between admissions and patients on numerous medications. Right,
so we were looking at the number of high attendances. We're looking at training for unpaid carers, so any people that you can identify that are carers.
Yes.
If you could identify them to us and offer them the option of some basic skills training, and it's based on that, the harm-free care booklet.
In our team, for instance, we've got consultants from A&E, from public health. We've got representatives from the pharmacy, from the mental health team, from different healthcare organisations.
People just get on and do things in the 100-day challenge. So I've seen people at the start with crossed arms, you know, I've seen this all before, this isn't going to make a difference, to just having a go.
We've just had a new volunteer start. I've got another one that I'm hoping to start. And what I'm intending to do is get out there, talk about Smart Life, talk to people, colleges, anywhere where I can find somebody that would be interested in doing something which is, I think, going to be extremely worthwhile.
We've had a 100-day challenge looking at how we can reduce risk factors in people who are at risk of developing diabetes. The excitement is we're focusing on something that's not yet disease, we're focusing on upstream. The 100 days gives us a time scale, it gives us a bit of momentum.
So the GPs were able to target people who we thought might be at moderate or high risk. So rather than just hoping that you find those people when you go out, it was a more targeted approach.
We've got a lot of help from the Diabetes UK to help with the risk assessments.
That gives you a score of 24, which is obviously less than
a lot better.
when you came down previously. In fact, it's moved you down into the moderate risk category.
So it just keeps things going, and I have to say, it keeps everyone very focused.
So I think the 100-day challenge does give us that opportunity to work closer together and try things out. It doesn't always work the first time.
I think for me now it's kind of how do we take the learning, whether that was stuff that didn't succeed or stuff that did, and spread it wider across this CCG and potentially wider in the health system.
We're trying to reduce inappropriate A&E attendances and outpatient attendances for 0 to 11-year-olds at Ross and Hamilton practice in Harlow. We're doing quite well, actually. We did have some problems with data initially, but looking at the figures, we're on target. We know that the patient discussion sessions in the joint clinics have reduced the number of referrals because the GPs could actually discuss the cases with Fiona, the paediatrician, and they prevented a referral into secondary care. So on a small scale, it's working well, and I think it's a model that could easily be upscaled.
We've gelled very well as a team.
We have.
Yeah. And worked very well. Yeah. We've actually progressed things very, very quickly.
Yes, we have.
The adult learning have come up trumps
Definitely.
to do that.
Yep.
Staff from the children's centres have been prepared to work on a Saturday and do the creches.
And that's the same with other people who've tried to get involved, like with Boots Pharmacy, we had that representative.
So the work with the children's centres has been a real positive for us. So we are going to baby groups and trying to educate and empower the parents before their children get ill so that they know how to deal with the common illnesses, particularly as the winter approaches.
Your first aid, you can't really go wrong. It's common sense, common sense, common sense.
For me, it's been quite interesting how everyone's wanting to get involved.
The impact will be, I think, phenomenal actually. I'm really doing it. It's a long-term goal.
Actually, just putting it all on a piece of paper and stepping back and looking at what we've done, I felt really proud.
We've been able to really say, if money were not an object,
They've set themselves goals.
if there were enough places commissioned,
We've all worked together as a team,
if we were able to work closer with someone,
and also learn from each other.
we've made these things, these ifs, like a reality.
In Waltham Abbey, I've never known all of us to get together to do something like this.
To see at the end what the team has managed to achieve in 100 days.
You kind of see a system coming together.
That's what's so exciting about it.
And it's just brilliant.
It's amazing.
A comment that was made to me by one of the people I did something with last Saturday was, it's great to see all of you collaborating and showing that you care.